And joining me now, Curtis Barnett. He is the CEO of Arkansas Blue Cross Blue Shield. Always good to see you, sir.
See you, Roby. It's been a while.
Yeah. You're looking good.
Thank you. You as well.
I know. Well, I've been working on some things. You've been working on some things.
Exactly.
It's good.
Exactly.
My health insurer tells me I need to stay in good shape.
Well, always listen to your health insurer. That's good.
Let's talk about the legislative session. A lot happening on the healthcare front at the state level. Tell me what you think was positive in terms of outcomes in this legislative session.
Yeah, a couple of things really come to mind, Roby. The first one, obviously, the Healthy Moms, Healthy Babies Act that Governor Sanders, Senator Irvin, Representative Pilkington, spearheaded that work. That represents transformational change for our state around maternal health care and the improvements that are needed and the improvements that can be made with that. It also shows what we can do as a state when multiple stakeholders come together and really focus on an issue and really can work on how do we move the dial in that area. So that's clearly number one of the most positive things that happened. I think the second one is really around the Medicaid expansion and reauthorization of the Medicaid expansion program, going forward. Not only does that take care of 240,000 Arkansans who are in need of health insurance coverage, but also the way that we did it, the structure. We've continued to work to tie the exchange market, the individual marketplace, to the Medicaid expansion population as well. And I think that's been very critical for our state. It's benefited us for the past 10 years or so. It's helped stabilize both programs, having them together in that certain way. And it's something that stability that we're needed. We've got some of the lowest individual health insurance rates in the country. We've had less volatility than a lot of states have seen, so that stability has really paid off in a big way. And I think that stability is going to become even more important, or there's a good possibility of that, as we look to January 1 of next year.
Did anything not get done in this legislative session that needed to get done? So
I don't know if there's anything that a lot got done, and so I don't want to invite any more that needed to get done. But I think one thing that we didn't take up this time that we may want to look at in a couple of years, and again, how can maybe the legislature help policies to help improve digital connectivity between providers of care, but also providers of care and payers of care. What can we do to exchange data much more seamlessly so that we can improve care coordination, reduce administrative burden, those types of things, and work together in ways that we haven't in the past. So I don't think we were ready this time, but we will be talking with legislators as we get ready for the next session in a couple of years on ways that we can work together in that way.
There was a big late session debate over pharmacy benefit managers, PBMs as they are known. You're in that ecosystem. Right. You'll have to tell me where you guys fit in on all that though. But basically we passed a law that says if you own a PBM, you cannot own a pharmacy in this state. Was that good policy?
The entire pharmaceutical space is a challenge, and it is an area where we need more balance in our system today than what we have today. Basically, Big Pharma, and I think it all starts with Big Pharma. They're able to not only set the price at whatever level they feel like is necessary for a new drug, they're able to make adjustments on a semi-annual basis. They're able to invest, last year was in the neighborhood of $14 billion on the direct-to-consumer advertising to drive demand for those drugs. And so whenever you have that kind of pressure in the system, that kind of large dollar investments in the system, it creates opportunities for others to maybe become part of that system as well. Others, middlemen, for example, to become part of that as well. So I think we need to look at the entire thing, not just the PBM's role, but the entire pharmaceutical part of the healthcare ecosystem.
Is that federal?
I think it's going to be federal. Yeah. I think it's going to be needed because I don't really see the states being able to do that beyond what they're able to do today, but I do think at some point the federal government, at some point very soon, is going to have to address that. When you think about pharmacy costs today are about 23% of total healthcare costs. By the end of the decade, it could be more like 28 to 30%. So it is already a huge challenge. It's going to become an even bigger challenge going forward.
Let's talk again. Another issue at the federal level is Medicaid funding. We are seeing all kinds of signals come out of Washington, D.C. Where this plane lands, we do not know.
That's exactly right.
But that's got to be something that obviously you're keeping a very close watch on. Yeah. What are your expectations? What do you think might happen on that front? Or are you just at this point in time just saying, let's keep all the cards on the table and let's just watch and see?
Yeah, I think it's really more of the latter, of the watch and see. So what you're talking about, the House has approved $880 billion over 10-year reduction in Medicaid spending. So far, the Senate has really not weighed in a significant way on this, so it's really going to be interesting to see how they begin to position this. But I think we all need to recognize that Medicaid is 20 to 25% of U.S. healthcare spending. 40% of children, 40% of births nationally are covered by Medicaid. Through our maternal health care work that we've done in Arkansas, we know that half of all births in our state are Medicaid. And so I think we have to recognize if there are big changes to that program, it is going to have a ripple effect in all the other markets as well. One of the things that insurers like Arkansas Blue Cross, large self-funded health plans, have been under a lot of pressure, especially this last session, about how can we increase reimbursement to providers to make up for low reimbursement that they get from government programs. That pressure is only going to intensify if we see the kind of Medicaid changes that are being proposed right now. And the commercial markets can't take any more pressure. This past year, we had 125 small groups. Those are groups that are 50 employees and below who dropped coverage altogether because of cost. That market, the commercial market, is already under significant strain, and we don't need to further strain it going forward.
Yeah. I guess to follow up on that, I mean, it's been reported that Blue Cross had a sizable loss this last year. Maybe, I guess, is that what is feeding into that? And explain to me what the potential turnaround plan is for you on that. So.
Yeah, and I think it's not just exclusive to our company.
Right.
I mean, our entire industry suffered those kind of losses this past year. Just about every major company, insurance company, health insurer saw elevated rates, probably the highest rates. I'm talking about cost trend rates that we've seen in the past decade. Most had experienced losses as on their core health plan operations as a result of that. So we were one of several companies that did that. Some of the factors that played into that, one is the redeterminations in Medicaid that happened in 2023. 2024, we saw some market disruption as a part of that. We've seen a lot of pressure, especially from the provider community, around increases in payment rates. That's understandable given the inflationary challenges they've been faced with, as well as workforce shortages. The use of healthcare services, utilization of healthcare services in particular, really skyrocketed in 2024. And just to give you an example, if you looked at joint replacements in 2024 versus 2019 before the pandemic, 37% increase. So a lot of pent-up demand coming out of the pandemic that resulted in a lot of that. So those were three of the reasons, in addition to high-cost claimants and then pharmacy costs that we've already talked about.
Maybe we'll see some different trends going forward.
I hope so. We sure hope so.
He's Curtis Barnett. He is CEO of Arkansas Blue Cross Blue Shield. Always a pleasure to sit with you, sir.
Good to
visit with you. All right. Thanks for being here.